coming today. I'm really all here for dinner, so we'll try to make it not too long. But anyway, thanks for having me. I'm Gayle Bieler. I've been a statistician at RTI for 27 years now. For the past year and a half, my role has been to build and lead the Center for Data Science, so it is a new thing at RTI. I worked in a variety of domains at RTI, toxicology, clinical trials, epidemiology, et cetera. I've sort of done it all in traditional statistics at RTI. But my favorite endeavors have always been those that combine statistics and anything entrepreneurial in nature. We developed and marketed a statistical software package called Sudan for complex data analysis that we used for sample surveys for many years, and now leading the Center for Data Science. So we'll talk a little bit about RTI first, about data science. In general, about our new center, how we use data science to further our mission, and who we look for. RTI is a research organization, first and foremost. Our clients are governments, foundations, and businesses. We were the first tenant in Research Triangle Park. Started in 1958 by the three area universities, state government, and local businesses. Broadly speaking, we solve problems in public health, social sciences, environment, and education. And someone once told me, I thought this is very true, and I've never forgotten it. When you work in the social sciences, your work is all around you. And I think this speaks to the relevance in our daily lives. RTI's mission is to improve the human condition through cutting-edge research and analytics. So we're here because we strive for impact. We want to improve the world, and people do take it very seriously. And I've seen in building our center that really is our secret sauce. We've been able to hire the most skilled, most creative, most intellectually curious people because of our mission. Examples of some of the things RTI has done recently, we have been reinventing the toilet in places that lack proper sanitation, like electricity and running water. That was through the Gates Foundation. We've been improving access to and the quality of health care under the Affordable Care Act, reducing jail populations, determining the extent of sexual assault on college campuses. We provided the 20% statistic that came out of the news in the White House in the past few months, but now we're doing much more extensive. That was only in a couple of universities, but now we're doing much more extensive research. We've been distributing treatments for neglected tropical diseases in places where it's endemic. We've invented most of the speed processing strategies for using cochlear implants. We've done a lot of work in malaria and HIV, and the list goes on and on. We're really all over the world with offices. Our headquarters are in RTP. We have, I think, 9 offices in the U.S. And a global workforce. We also have offices overseas. A total of almost 4,000 employees at 250 disciplines, and we're in data science supposed to be working with all of this, so it's all order. And I've listed some of them here. It really covers quite a bit of technology, social science, and engineering. I'm just going to pass this one. Just good stuff to come. Okay, so here we go, Center for Data Science. Let's talk about us. Here's the team. Right now, as it exists, 15 of us. I really could spend the whole time on this slide, because to me the people are what make us great. We don't sell widgets in RTI. We sell the skills and abilities and creativity of our staff. In this center, we have, in the past year and a half, have chosen everyone very carefully, and we continue to do so. We are a team of data scientists, statisticians, predictive modelers, and developers. We've grown from 5 people just a little over a year ago to 15 at this point, and we're still growing rapidly. Everyone has technical expertise in data science-related disciplines, statistics, analytics, computer science, etc., as well as domain expertise. So people have bachelor's degrees in public health, environment, economics, the life sciences. So we truly are cross-disciplinary, and we find that that really does help. Data science, we always say data science is a team. So people that have skills in both data science technology disciplines as well as the social sciences and the liberal arts do very well. And this year we got our center off the ground and we created excitement for data science at RTI. We learned a lot about how data science can advance the work of domain researchers across RTI, as well as clients in the federal and local government. We learned the importance of intellectual engagement between research disciplines, and that data science is a scientific discipline of its own. So, what is data science? You hear the term a lot. It's sort of a new term, I think, maybe in the past 4 years or so. It's been a thing. Before that, it maybe was called big data, but now people just use the term because it is a discipline, data science. And really, it's fundamentally about turning data into actionable insight, knowing what has happened, what is happening, what might happen. Really important to know how to predict the future, what might happen, and how to make something happen. Data science helps people make decisions, and it is often visualized beautifully. What music should you hear next? What ads should you see if you go to the New York Times website or any website? What treatment regimen is best for you, and in particular you right now? Which hospital patients are at high risk for developing sepsis or heart failure, or at high risk of having a readmission in the next 30 days after discharge? When a teen calls the crisis text line, which teens among them are at highest risk of committing suicide and therefore need intervention immediately? Which credit card transactions are likely fraudulent? In all cases, we want to find the optimal solution, we want to make the recommendation, and we want to solve the problem. Okay, so how do we use analytics to build value, to do good in the world? A little context first. In my mind, traditional statistics research is about contributing to knowledge through things like estimation and hypothesis testing. And that's important. RTI has always done that and will continue to do that. Now, while statistics is the foundation of data science is about contributing, as I mentioned, contributing to action, informing decisions, and targeting interventions. So what we do is we find and integrate relevant sources of data and create data products and tools. Okay? I think on this slide I said that we build data products that showcase the value of great data sets. So we don't just deliver the raw data, but also value-added data products that integrate and present information from multiple sources that actually sit on top of data and showcase its value. The data product is just a tool that solves a problem for customers, clients, and stakeholders. So that data product may be a predictive model that's used as a decision tool for monitoring and alerting, or it may be an interactive web application that monitors events in real time and provides ongoing actionable insights into a problem. Some of the examples from the research that we've done we've developed tools, or we are developing tools for personalized medicine, so predicting the best course of treatment or screening regimen for your particular circumstances right now. We are developing wearable sensors that predict seizures in children with epilepsy in real time. We are developing a predictive model for the risk of neurodegeneration after suffering concussions. So what we want to do is focus interventions and resources early and only on those who need it. We're developing a data-driven policing tool that makes policing more informed, more just, and community safer. We've developed interactive tools that predict how infectious diseases spread throughout a community and help governments prepare for, detect, and respond to infectious disease threats. One other example, we've developed a real-time disease surveillance tool, which I'll show you a little bit later on, that it was used at, and can be used at mass gatherings in developing countries. So our mission in our center is to advance research. Create new tools, methods, products, and services that make research faster, richer, more useful. We advance research by infusing a data science mindset and methods into all of our research disciplines. We educate, we inspire, we deliver value through collaboration, analytics, and related data products. We also collaborate with our subject matter experts in all of RTI's domains. As I mentioned, data science is a team sport, so we collaborate closely with our internal and external clients, because stakeholder involvement is critical to delivering accurate work quickly. the middle here is one of our domain researchers, and on the right is one of our data scientists. Okay, so everything that we do, I would say, is basically problem solving. That's the best way to describe what we do. But sometimes defining the problem is the hardest part. Data science is not something you sprinkle onto a project to make it look better. It should be integral. If you really want it to work, it must be integral to solving a specific problem and used in designing the solution to that problem. We do a lot of predictive modeling, and some people call that machine learning. I'm not going to get into the details of that, but prediction is at the heart of data science, and this is where we differ a little bit from traditional statistics research. Traditional statistics research focuses more on estimation and hypothesis testing. But in data science, you want to focus on prediction. You want to move beyond the rearview mirror of a description of what has happened or is happening into what might happen, and under different scenarios. Data visualization, the point here I'm going to make, is a really huge component to data science. It's what encourages user engagement with the data, participation versus consumption, and it tells a story. So I think those are the two most important parts of data science, but there's many other things. There's a lot of data munging, acquiring the data, storing it, cleaning it, etc., and developing analytic pipelines. We do a lot of work with text analytics, natural language processing, social media, etc. That is very popular now. It's one of the, I'm going to get into a little bit more, but it's one of the most difficult subjects in computer science. Okay, a little bit about our process. We like to apply what's called design thinking or user-centered design to our data science process. We start with understanding human need, the people, the culture, the context, what's the problem we're trying to solve, who are the stakeholders, and what are their needs. And that requires listening, observation, and brainstorming. And these are the ideation and design phases. We also like to iterate through rapid prototyping. We believe that if you're going to fail fast, learn from what didn't work, and pivot in a new direction. Prototypes help us to learn about the quality of our ideas and rapidly improve upon them. So we employ rapid prototyping to help internal and external clients explore ideas, focus project plans, improve their designs, and realize completed projects with less missteps along the way. We actively evaluate our ongoing work. We shed bad ideas quickly, and we employ design thinking to meet stakeholder needs in a graceful fashion. Wherever possible, we like to visualize what we're doing. As I mentioned, data visualization is an important component of data science. It encourages user engagement with the data. It tells a story. It demonstrates the value of data products. We also prefer to use open source software. We tend to avoid proprietary software packages, which are expensive and to purchase and to implement. And it seems that most data scientists do prefer open source software today. So if you're using things like R, Python, that's all good. So this slide is really just to show that the technology stack that we use, there's a lot that goes into it, and it really just depends on the problem at hand. And we apply whatever tools are necessary to solve the problem. We tend to use open source software, and that's really all that's it. Our group is casual, it's friendly, it's flexible, it is a collaborative environment, and it is fast-paced. There's a lot going on. We only have 15 of us. We are a company of 4,000, and our mission is to work across all the disciplines. So it's become very popular that we have to do a lot of educating at RTI so people know what data science is and how to help them. It's going to be a pretty busy place, and that's why we're constantly hiring. But the people, for me, the people are the best part of the job. It's the best part of any job. I think the collaboration that you find when you work with people is the thing you learn from the most. I'd just like to quote DJ Patil, who's the first U.S. chief data scientist. We actually have one now. And he is doing a really great job in federal government, with digital service, et cetera. It's all new in the federal government. But his quote, and he's been through LinkedIn and Relate IQ, he's done it all, he's got a PhD, et cetera. He had a really nice quote on jobs with impact, which I like. They say the greatest jobs are the ones you laugh in, cry in, work with the world's best, and just maybe you'll have a chance to change the world. That's every day in this job. Every day I get to wake up and work on things that will directly impact my kids' lives and their future kids' lives. That's what I'd call the definition of epic. So I read that and I really liked it, and I think that it relates to at least my job, and I think that everyone in our group as well. Also, at the recent, there's a big data science conference twice a year in the US, and it's overseas now as well, called Strata. And we were just there in New York City at the Javits Center. There were 6,300 people in attendance. Some of the most well-attended sessions were those about data for good. Data science, you have to remember, started in the business world. Okay? Marketing and modeling consumer behavior. Those are important. Okay? And that still represents the bulk of data science jobs: finance, insurance, marketing, banking, etc., marketing. So the concept of data for good is very appealing because there's not as many jobs in data science for that. But the five of us that were at the conference from my group, we're all looking at each other and thinking, well, we do that every day. So that's really cool. So what do we spend our time doing? We work on a lot of projects. We work on proposals so that we can win more interesting projects. And we do independent research. It's very important for data scientists to have time to be innovative and to be constantly learning and building up their toolkits. We do presentations to clients, internal, external, to RTI management, and at conferences. We were recently presenting to the RTI Board of Governors on everything that we've done this year, and that was a lot of fun. We spend a lot of time teaching, not to one another, but to people around RTI. We visit our regional offices, and just a lot that goes on. And as I mentioned earlier, it is an atmosphere of continuous learning and collaboration. So what I'm going to do now is just get into a bunch of examples. I hope not to spend too much time on any one of these, just to give you a flavor of some of the things that we've done. There's someone in my group who does a lot of predictive modeling around personalized medicine. He's also done a lot with alcohol and drug abuse. And we do a lot of work with HIV. He had a grant that was looking at different types of, this was among drug users. So there were these syringes that either had, some of them had a lot of dead space in them, and some of them not. And so he did a lot of modeling to figure out that over time, those syringes that had more dead space in them were likely to lead to epidemics of HIV. So this had a big impact on the World Health Organization that quickly switched out those syringes with the dead space and probably saved a lot of lives. Another one of our data scientists has been working with our engineers to develop a seizure monitor. Children with epilepsy will often have, seizures that come on seemingly. It's hard to know when one's coming, and so caregivers have to be constantly alert because it can happen while they're sleeping as well. And so we've been developing a monitor that a child can wear that, through predictive modeling, can alert the caregiver to when physiologically when a seizure is about to happen, or to happen soon, or likely to happen. So that is still under development, but it will be a really nice thing for children and their caregivers. So we work with the engineer to get the data from them and in real time to predict the seizure. And I think we've been having some pretty good luck with that so far. Our next few slides talk about social media. RTI has done a ton of work over the years collecting data through sample surveys, large sample surveys, very expensive to design and to implement. By the time we design the study, collect the data, it takes a couple of years to analyze it. It can take a couple of years. So what is a faster way to get data on people and cheaply? And that is social media, particularly Twitter, because the data is generally open. So that's what we've spent some time looking at is, can we use streaming social media sources like Twitter to either augment or even replace sample surveys in some cases? It's not clear when that would be appropriate. Certainly the data coming off of Twitter is not necessarily representative of the population that you're interested in. But we've been experimenting with it. We've used it a lot to evaluate public health campaigns coming out of either CDC or FDA. And we've been using things like text mining. And I just want to say that some people call this natural language processing. This is one of the toughest problems in computer science. So, yeah, Twitter has a lot of data. Yeah, it's free generally from the Twitter API. You can get a certain amount of it free. But it's a big haystack. There's a few needles in there, but it's not really clear how to get those needles. So it's a tough problem. We've been doing a lot of work with it, social network analysis, etc., text mining. Try to take a tweet of 140 characters and use that text to predict someone's age. It's not easy. But we've been doing a lot of that recently. We do work evaluating tobacco campaigns as well as e-cigarette campaigns. There's a lot of work going on now with e-cigarettes. So I'm not going to talk too much about this because it gets kind of technical really quickly. I just want to also say that one thing that data scientists like to do is come up with pipelines. And we've created a pipeline that makes it a lot easier for researchers at RTI to get the data, clean it, analyze it, visualize it, and write reports about it. So the social science researcher at RTI does not need to know Python. It doesn't need to know how to get the Twitter data from the API. We've developed a tool, a pipeline tool that will get that data for them and do everything that they want to do and start collecting data according to the search terms of interest. And we'll do custom analysis we can add to this tool that has a plugin infrastructure. So we've had some very good luck. And that's the kind of thing that data scientists will do, is to create analytic pipelines. So that's been very helpful to our social scientists. The next few examples come from data visualization. And I can't stress enough, the things that we do the most at RTI are data visualization, text analytics, and this data plunging, data integration, and combining data from all different sources. There was a project in our international development group about neglected tropical diseases. And this was with USAID. They've been collecting this data for several years, but it was completely inaccessible. It was not being reported about. USAID has to report back to Congress about their programs, and they were not able to do that. They did not have a really easy way for a non-technical person to be able to understand what was going on and understand the impact. So we created a dashboard, a visualization tool that is interactive and allows you to kind of slice and dice through the data. It's got maps. You can hover over the maps and see what's going on in different areas of this. This is Uganda. So it's completely interactive and it's all open source. And it really helped. USAID was really happy because it helped them to support advocacy and it helped them to do program planning. And after several years, they finally had something that could tell a story. So we did what we did was a quick prototype showing a couple of screenshots here, and we're about to go into a full implementation all the years from the Neglected Tropical Disease Project. Part of our focus is on building, as I mentioned, products and tools that are inspired by the projects that we work on. The project will only have a certain budget and have a certain problem that you're trying to solve, but sometimes we see that there is a larger tool that can be created from that project and either used on other projects or open sourced, etc. But these are tools that build in innovation. As I mentioned, they feed back into projects and proposals, and they are very useful for creating a public-facing brand for data science at RTI. One example of a tool we're building right now is called CFS Analytics. It is a data-driven decision tool based on 911 call for service data, which is a rich source of policing data that's often ignored in crime analysis. The intention is to make policing more informed, more just, and communities safer. Safety and justice is often about getting the right info to the right person at the right time in the right way to make communities safer. So this is a great example of a product that has grown out of a project. And it is we're now fully productizing it and building it out through a collaboration between our data scientists, our social scientists, and very cooperative police departments, Durham and the Tampa police departments that are willing to share their vast trove of data and policing insights with us in return for a platform that delivers insight from the data. So not only does it demonstrate the technical capability that we have to bring great ideas to life, but it helps to fulfill RTI's mission in a very tangible way, working in the local community, which has been really fantastic, with direct access to partners on the TV. And I think that the potential for the direct and immediate impact that not only engages and motivates people, but in my mind is the essence of what data science is supposed to be about. It's been one of the most fulfilling experiences that I've had at RTI in working directly with the local community. This was something a little bit similar. We created a national crime statistics reporting tool for the Bureau of Justice Statistics. There's something called NIBRS data. It's the National Incident-Based Reporting System. It's been around for decades. It's been hard to get police departments to enter their data into the system because they really get nothing in return. And so the Bureau of Justice Statistics was wondering if we can create a tool that can then allow them to see their data, how they compare to other departments, etc., and learn something from it that maybe they would be more likely to enter their data into the system. And so we took data from 9 million NIBRS incidents from 5 reporting states, and we created a very nice tool, and again, extremely, it's interactive, it's web-based, and we had not only did the Bureau of Justice Statistics love it, but we presented it to 30 police commissioners, and they were all completely on board. So it's nice to be able to have that impact. So the next example, got 2 Okay, so the RTI synthetic population viewer. We had a project a few years ago called MIDAS, Models of Infectious Disease Agent Study. And what we were doing there was using statistical and mathematical models to understand how infectious diseases spread in order to help governments prepare for, detect, and respond to infectious disease threats. And in doing that, it wasn't our group that came up with this, by the way. It's a different group at RTI that focuses on maps and GIS stuff. So they came up with this synthetic representation of all U.S. households and individuals using very sophisticated simulation models. And it's accurate to a set of 4 household characteristics: household size, age, race, and income. And they use data from the 2010 census as well as the 2007 to 11 American Community Survey. These are dot maps, and each dot on the map represents a single household. I'm going to go to the next slide where we're just looking at the triangle, and we're just looking at income. And so what you can see is that the areas that are gold and brown are the lowest income, and the areas that are blue and turquoise are highest income. We did something, and you can do this, the earlier one has panels for age and race and household size as well. We did something similar for obesity. It was a national obesity challenge to use open data to solve a social problem. And we used this approach, and we got second prize. So the synthetic populations have a lot of not only impact, but applications, lots of problems, not just modeling infectious disease. This was another dashboard that was done in North Carolina. It was created for the North Carolina Chamber Foundation to track North Carolina's progress in economic development, business climate, and job growth. It was another interactive map-based tool that offers timely information on how North Carolina compares to other states and how counties within North Carolina compare to one another. That's pretty cool. The last example that I want to show you. This is something we just did. Let's see, one of our data scientists has a connection. He went to, got a master's degree at the Harvard School of Public Health. And there's an organization called the Harvard University South Asia Institute there as well. And they were doing some work in India. They wanted to show how mobile health can be used right now in developing countries. And so they started this project called the Jana Swasthya Project. And Jana Swasthya in Hindi is public health. Every few years in India, there is a religious festival called Kumbh Mela. It attracts millions of people, sometimes tens of millions of people. And part of what they do is they're bathing in holy waters in the Godavari River. Okay, so you can see that this could be a public health, what could possibly go on? This could be a public health crisis waiting to happen. You just don't know what sort of diseases could be spread. So this project is intended to do real-time disease surveillance at the world's largest gatherings. So from July through September this year, 30 million people were traveling to 2 cities, Nashik and Trimbakeshwar in India, to bathe in the holy waters. And amidst this mass gathering, supported by acres and acres of temporary parking lots, police stations, fire stations, health clinics, streetlights, and toilets, a small band of health and IT experts from the US and India introduced a new mobile health surveillance system to help keep the millions of visitors healthy while they were at the festival. So the goals were to conduct disease surveillance in real time to help health workers at the festival nip potential outbreaks in the bud, and then to allocate resources wisely. The other is more long-term, to conduct a mass screening program for oral health, hypertension, and diabetes for visitors and workers at the festival. Okay, and so the government issued tablets. Now people would come into the clinics. There were, I think, 37 clinics. People would come into the clinics with their health issues. Everything would be recorded on the tablets, but what they didn't have was a way for people to see, visualize what was actually happening, and to report about what was happening in, across the clinics. So they contacted us because they knew one of our data scientists. Can you create a real-time dashboard in about 3 days that will be able to monitor what's going on? Of course, we said yes. And they were incredibly successful. This was the India Ministry of Health were very excited. The doctors on the ground were very excited. It was written up in the Times of India. Harvard University has, this is part of their website about it. I just have a few screenshots here. So it provided real-time interactive visual analytics that help the researchers and the government officials follow clinic load and disease burden closely throughout 4 weeks of clinic operations. So after the first week, they were able to reallocate resources as they saw that there were more problems in some areas versus others, and they were able to prevent epidemics. Just a couple more screenshots. Again, it's all completely interactive and in real time, and it also produced the tables that they needed as well, so they could see what was happening one day versus another day, etc. And this is just a shot of someone actually pulling up the dashboard on one of the tablets. So this, everyone was very excited about this. There's a quote from the Harvard website blog. One of the doctors said, "I can tell you exactly how many patients had joint pain in the Dashat clinic in the past 3 days. I can also tell you precisely the moment that patient volume peaked at the clinic. I can say with 100% confidence how frequent a diagnosis of back pain has been thus far across all 37 clinics in the 2015 Crumella. This isn't anecdotal data. I'm not at the Coombe. I won't be there for another 3 weeks. I write this as a researcher supporting our disease surveillance system from the other side of the globe. The name of this dashboard is called EM Counter. EM Counter brings real-time surveillance to my fingertips across the globe. Healthcare just went from reactive to proactive, the power of big data." And at RTI, our Office of Corporate Counsel, one of our members there, said, "Congratulations to the RTI Center for Data Science team for this excellent piece of work. It's amazing to see this modern surveillance tool being applied to an ancient observance, massive gathering of identity. I'm glad seeing the results of the data collection effort energize the folks at India's Ministry of Health." We also presented this to the RTI Board of Governors and at USAID last week. They are USAID, the United States Aid for International Development Agency. They are very much interested in real-time data systems for evidence-based, adaptive, and agile decision-making. It's among their highest objectives. Which also reminds me of another quote from T.J. Patel, who says that first responders are now data scientists. So, what's next? The Harvard South Asia Institute hopes to see an explosion of mobile tech solutions to serve the most pressing public health challenges in India of access, personnel, quality of care, chronic disease education and management, and accurate information. And what's next for RTI in this area? We're going to continue pursuing data science for health and human rights. We've been asked to extend this tool to other resource-poor settings, in particular rural hospitals in India, and other transient gatherings around the globe, in particular refugees. They're also interested in looking at monitoring hate speech for early warning against mass atrocities, and also they're interested in disaster preparedness and response. So that's some of the examples of what we do. If you want to learn more about data science or data science for good, there's some books here that I thought might be of interest. These are all very recent data scientists at work. You get a really good idea about what data scientists do in all kinds of industries, not just in Digital humanitarians in particular is about the examples, stuff like the example I just showed you, and doing data science is also a great read, and you get better ideas about how data science is practiced in different industries. The other thing is that there are other data for good organizations. RTI is not alone in that. A couple that I wanted to point out here. So for you undergrads and graduate students, in the summertime, there's something called Data Science for Social Good. It's run out of the University of Chicago. It's a 3-month fellowship. If I were you and I was interested in this stuff, I would do it now. It is a really good program. I don't know of another one like that except for internship at RTI. I don't know of another one that is, they're working with real data, with open data, and they're having an impact. So I totally recommend it. And DataKind is another organization that is run by a guy named Jake Corway, and I think that is a little bit more people who are already professionals and doing volunteer work. That's the impression that I get. But the data science social good is for college students, and something definitely to look into. So what kind of skills are involved with data science? Well, everybody debates that, but it's basically at the intersection of math and statistics, computer skills, and sometimes people call that hacking skills, but it's definitely coding, okay? Coding in software like R and Python. Others as well. Understanding database, that sort of thing. And also substantive expertise. So I mentioned that if you want some kind of background in the liberal arts or engineering or environment, education, whatever, any kind of social science or liberal arts, that's great because, as I mentioned, it's at the intersection of all these 3 areas of understanding that you find data science there in the middle. Long-term career prospects. Okay, so someone said about 4 years ago that data scientists is the sexiest job of the 21st century. I think that's great. We never said that about statistics. So that was in the Harvard Business Review. So data science became popular in business, marketing strategy, modeling consumer behavior, but it has since entered all other domains. Okay? And it's for people who like to solve problems with data, and code, and who are intellectually curious. And where can you work? Basically, I have a whole bunch of stuff listed, but basically it's everywhere from a traditional retail business like Walmart, every internet company like Google, LinkedIn, Netflix, Amazon, Etsy, the entire federal government, and every research institute, RTI included. And I think, there's really no limit. It's amazing how we compete with Google, we compete with Elon. It's really interesting. It's a new world. A little bit about the federal government's interest in data science at this point. The federal government is more data science oriented now than a lot of businesses. They have quickly plummed up over the last few years. There is, for example, we now have our first United States chief data scientist, that's DJ Till. We have a U.S. digital service whose goal is to make government services simple, effective, and efficient. There were new White House data science initiatives announced frequently. Recently there was a police data initiative announced and a smart cities initiative. Every major government agency has its own big data initiative, key data personnel, and there's generally a major shift towards open data in the government. So all research going forward needs to be open. The data needs to be open. That means publicly accessible and machine readable. And I was at the Strata conference and they announced their new White House initiatives on data science. They're primarily interested in precision medicine, suicide prevention, criminal and social justice, the police data initiative, child labor and trafficking, and data ethics. So these are all things that RTI spends a lot of time on. Okay, so who do we look for? Pictured here are a couple of our interns. Jillian was our 2015 summer intern, and Jason was our 2014 summer intern. Jason was a junior, and he now came back to join RTI, so we're very lucky to have that as a full-time employee. We look for versatile people who like to solve problems with data, people who are intellectually curious and have an analytical mindset, people who are collaborative, because as I mentioned, data science is a team sport. So we work with domain experts, subject matter experts, external clients, as well as one another. People who are communicative, who have storytelling skills, both written and oral, are important. Of course, the computational and quantitative skills, so statistics, computer science, analytics, the foundations. But if that is combined with things like the liberal arts or other life sciences, hard sciences, we find that really helps people to think outside the box. I would add in a sense of design. I read recently that today's business requires both analytics and artistry, and when you see how much visualization work we do, you know that's true. We taught a course at RTI, one of our data scientists taught a course at RTI recently on creative coding and generative art. So you can actually use this software called process and coding to do art. So it's very interesting, and the seats were gone for that in a matter of hours, so we'll probably do two more sessions. As I said, we also focus on open source software, so we look for people who have skills and interest in that area and emerging technologies in general. Yeah, that's basically it. I am